everyone, my name is Dr. Tang with Forest Lane Pediatrics, and today we will be talking about asthma and how to use some common types of inhalers to help manage your child's asthma. Asthma is a very common medical condition where the airways become inflamed and constricted, resulting in a cough, wheeze, shortness of breath, or chest tightness. 1 in 12 children have asthma, so it is a very common pediatric illness. If your child has asthma, this means that the airways leading to their lungs are more sensitive to certain triggers. Some common triggers include just being sick with a cold, changes in the weather, especially during the winter and spring, exercise, secondhand smoke, and allergens like mold or pollen. Having a child with asthma can be overwhelming, but knowing how to help your child avoid triggers and use their medications correctly is key to asthma management. Depending on the frequency and severity of your child's symptoms, your child's doctor may prescribe different types of medications to help your child. The two types of medications are short-acting and long-acting medications. Short-acting medications, otherwise known as rescue medications, will help relieve shortness of breath, wheezing, or chest tightness very quickly. This medicine is often used on an as-needed basis every 3 to 4 hours whenever your child has symptoms. The most common short-acting medication is called albuterol. If your child has symptoms that are persistent, more than twice a week, or nighttime symptoms more than twice a month, your child's doctor may prescribe a controller medication like an inhaled steroid. These are called controllers or long-acting medications. These medications do not help in the acute setting and do not provide any immediate relief. They, however, will help over days to weeks to reduce inflammation and are most effective 2 to 4 weeks after initiation of use. Some common examples are Qvar, Flovent, and budesonide. The medicines we just discussed can be prescribed in the form of liquid vials used in a nebulizer machine, meter-dose inhalers connected to a spacer, or dry powder inhalers that do not require the use of a spacer. Younger children will benefit from nebulizer breathing treatments, whereas the older children with cooperation can master the use of an inhaler. The following are some general guidelines on how to use an inhaler, but be sure to double check the instructions that came with your child's inhaler or nebulizer. First, we will talk about the use of a meter-dose inhaler, often referred to as an MDI for short. The key to using this type of inhaler correctly is ensuring that your child has a device called a spacer to connect the MDI to. This is what a spacer looks like. The spacer holds the medicine in place to help your child breathe the medicine in easier and helps it deposit into the lungs where the medication is supposed to be. At the front of the spacer is the universal end cap where the MDI goes into. Next is the anti-static chamber in which the medicine flows through and stops at the valve. The valve then opens when your child takes a breath in. There are 2 techniques to using an MDI with spacer. The first technique is called single breath technique. This technique is best used for children who can hold their breath for around 10 seconds. First, you will take off the caps from both MDI and spacer. If your child hasn't used their inhaler in a while, please prime the inhaler by spraying it 3 to 4 times away from yourself. Every inhaler is different, so remember to read the instructions on how to prime your inhaler. Shake the inhaler well for about 3 to 5 seconds. Connect the inhaler to the spacer using the rubber ring at the end of the spacer. Have your child sit up straight and tilt their head back. Have your child take a deep breath in and blow out to completely empty their lungs. Then place the mouthpiece of the spacer in your child's mouth and have them form a tight seal with their lips. As they start to breathe in, press down on the inhaler for 1 puff. Ask them to breathe in slowly and deeply. Have your child hold their breath for about 10 seconds or as long as your child comfortably can. Here goes. Wait 1 minute before you administer a second puff. The second way to use an MDI with spacer is called multiple breaths technique. This technique may be easier for infants and younger children who cannot hold their breath for very long. Another thing to keep in mind is that if your child cannot form a tight seal on the mouthpiece of the spacer, ask for a face mask that can be connected to the spacer. The face mask comes in different sizes, so make sure that you have the right size mask for your child. When placing the mask on, be sure to get a good seal on your child's face. You will press down on the inhaler once for 1 puff, and then you will encourage your child to breathe in and out slowly for 5 breaths. Here it goes. If you hear a whistle noise through the spacer, that means your child is breathing too fast and you need to tell your child to slow their breathing down a little bit. Next, we are going to talk about a different type of inhaler called a dry powder inhaler. These inhalers do not require the use of a spacer. Brand names include ProAir Respiclick and QVAR ReadyHaler. Unlike other medicines that deliver a puff of medicine, this type of inhaler holds the medicine as a dry powder, so your child has to breathe in really deep and really fast to get the medicine in their lungs. Usually this type of inhaler is meant for children over the age of 6. To use this inhaler, hold the inhaler upright and open the cap fully until you feel and hear a click. This type of inhaler does not require any priming. And remember not to block the vent above the mouthpiece with your fingers. Do not shake this type of inhaler. Before your child inhales, have them breathe out through their mouth and push as much air from their lungs as they can away from the inhaler. You will put the mouthpiece in your child's mouth and have them close their lips tightly around it for a good seal. Instruct your child to breathe in quickly and deeply through the mouth to deliver the dose of medicine to the lungs. Remove the inhaler from your child's mouth. Then have your child hold their breath for about 10 seconds or for as long as they comfortably can. Then breathe out slowly away from the inhaler. After that, close the cap firmly over the mouthpiece after each inhalation. Here it goes. If your child needs another dose, then you would repeat the above steps again. I hope you found this video helpful. For additional resources to help you manage your child's asthma, you can also check out our website at www.forestlanepediatrics.com. If your child is having symptoms of asthma more than twice per week, please contact your child's doctor so that we can discuss ways to improve your child's symptoms. Remember, we do recommend the flu vaccine every year for every child. However, we strongly recommend that children with asthma get their flu vaccine as they are at higher risk for developing complications from the flu like pneumonia.